Hello, I'm Dr. Tien Nguyen, and I'm a board-certified dermatologist at Tono Health based out of New York. Thank you for taking time out of your busy schedule to watch this brief video. The topic for today's discussion is hidradenitis suppurativa in adult patients presenting to internal medicine providers. This education is brought to you by the HS Foundation. Part of the foundation's mission is to help educate all providers about proper diagnosis and management of HS. Let's start with our first objective: how to diagnose HS. HS typically presents in adolescents and young adults, but it may also affect older adults. It has been shown to disproportionately affect women as well as people with skin of color. If a patient complains of a history of recurrent pimples or boils in the skin folds, with flares occurring every few weeks to months, this should cue you to think of HS. Characteristic findings include nodules, abscesses, and draining tunnels in the axillary, inguinal, inframammary folds, or the gluteal cleft. However, other exam findings as well as locations have been described, so please keep the diverse presentations of HS in mind. Diagnostic delay, often up to years, is still a major clinical challenge for this debilitating and stigmatizing disease. If suspecting HS, please consider screening for its comorbidities, including, but not limited to, tobacco use disorder, obesity, diabetes, metabolic syndrome, depression, anxiety, polycystic ovarian syndrome, inflammatory arthropathies, and other follicular occlusion conditions like pilonidal cysts. As you already know, a collaborative approach is important in optimizing outcomes for patients with HS. Now that we have covered our first objective, let's discuss how you might be able to help expedite care for patients with HS. Once a diagnosis is suspected, a referral to dermatologist should be made as soon as possible because time to first appointment is variable depending on access to specialty care. Moreover, a partnership with dermatology might confer patients and families some needed reassurance that the HS will be managed with the level of care and attention that it deserves. While waiting for the patient to see their new dermatologist, you might want to try some initial treatment, especially if the patient has not received any for HS in the past. According to the latest guidelines from the US as well as Canadian HS foundations, topical treatments for HS may entail skin cleansers, keratolytic agents, topical resorcinol, or topical antibiotics. Adjacent to this topical approach is intralesional steroid injection into inflamed HS lesions to help reduce pain and inflammation. Systemic antibiotic for HS, as in other conditions, is complicated by the role of antibiotic stewardship. If needed, typically an 8 to 12-week course of an oral antibiotic, like a tetracycline derivative, might offer some benefits in patients with milder disease. More advanced or recalcitrant disease requires complex management, where systemic antibiotics are often combined with other modalities like systemic anti-inflammatory treatment and or procedures. It's been my pleasure to share my perspective with you today. Thank you for supporting the HS Foundation, and especially thank you for being a part of the effort to improve care for our patients living with hidradenitis suppurativa.